Fantastic. Well, thank you everyone for joining us today. We're really excited to have you and our panel of experts talking about RX prevention and evaluation. I want to just briefly introduce everyone, and then we can start with our questions and then open it up for questions afterwards. So first, we have Danielle Campbell. She is the public health consultant and founder of PM Consulting Group, specializing in running public health projects, which include strategic planning, project management, implementation, monitoring, and evaluation. Today, she'll be talking about her experience as the project manager for the University of Houston's Educate Before You Medicate program, as well as the Texas Improved Dissemination and Evaluation of Single-Use Disposal Systems, TIDES project. That's really a mouthful, at the University of Houston's Premier Center and College of Pharmacy. So Danielle has created evaluation of statewide initiatives using bilingual tools and trainings to reach diverse populations. So she'll get into that a little bit more in detail. And then we have Jenna Adams from Fresno, California. She is the program manager at Fresno County Department of Public Health. Jenna has over 25 years of experience supervising various public health programs, including STD and HIV prevention. She sits on chairs, and she is going to be talking more about reaching the community with harm reduction vending machines, which is a really exciting topic of conversation that we've been hearing more about throughout the country. We have Maria and Marissa from Broome County, New York. Maria has an extensive background in substance use prevention and is currently the prevention coordinator for the Prevention Coalition of Broome County, New York. As the coalition coordinator, she focuses on overall community substance use prevention and coalition building, guiding the coalition through the stages of SAMHSA's strategic prevention framework to assess community needs and implement community-wide prevention strategies. And then we have Marissa. She is the supervising public health educator, overseeing the Overdose Data to Action Grant Initiative, and acts as the Broome County Opioid Overdose Prevention Coordinator for Broome County, New York Health Department. Ms. Knapp has worked in the community for 20 years on an array of initiatives that include evidence-based programming, pilot projects, and public health initiatives to create policy, systems, and environmental changes. So Maria and Marissa are going to be talking more about their prevention outreach and education within Broome County, including partnerships with hospital systems and retail pharmacies. So we're going to kind of kick off the conversation by having each participant give us a high-level overview of their project, and then we'll kind of just ask questions and prompt from there. So looking forward to the discussion, everybody, and thank you again for being here. So Danielle, if you would like to start and just kind of give us a high level of your project and the work you've done with University of Houston, that'd be great.
Okay, sure. Good morning, everybody. Thank you so much for being here. And I welcome the opportunity to talk about the work that we did through the University of Houston. We received 2 large public health grants from SAMHSA, but their overarching goals were to prevent prescription drug misuse through the use of single-use disposal systems. And so, like Megan mentioned, we had 2 projects that we came up with. And really, the first one, they gave us a lump sum of money and said, hey, we kind of don't know what to do with it. Help us develop a program that could help. And so the first one that we did was called the Educate Before You Medicate. And with that, we indirectly provided pharmacists with the support they reported so that they, in turn, could counsel their patients. And so what we decided to do was first, we developed a needs assessment to try to figure out what the problem was. And so what we found out is that pharmacists actually had difficulty speaking with their patients because they said they didn't have the resources they needed. They didn't have the tools. They didn't feel like they had any support from physicians or also from the higher ups. And so they also said one of the things that we identified was that they would tell patients when they came in to fill the prescriptions, especially for opioids, that they were out of stock. They were so afraid to actually prescribe or actually fill these prescriptions that they would say they're out of stock or tell them to go to another location. So with that needs assessment, that kind of paved the way for us to build this project. And so I know I only have 5 minutes and I could talk all day about it. But what we decided to do was to educate the coalitions. So we created a video so that the local coalitions and nonprofits could go out and speak with the pharmacies. And so with that, the nonprofits and the prevention groups that we were working with could also get the pharmacists engaged, and actually a bunch of them joined their coalitions. And they also were able to give out these single-use disposal systems that the coalitions would give to them. We also provided them with a handout, kind of like a pocket card. We call it the physician's pocket card, which reminded them to use the prescription monitoring program to look up each patient. It also reminded them to counsel each patient that came in on, hey, not just, hey, do you have any questions? But we said to them, hey, you know, especially if it's a high risk medication that you're giving out to, you have a responsibility to tell the patient, hey, if you have any leftover medications, you have a responsibility to dispose of it. And so that when that project kind of morphed into the next project, which is the Texas Improved Dissemination and Evaluation of Single-Use Disposal Systems. It's a little bit of a mouthful, but with that project, Texas Health and Human Services came to us and said, hey, we distributed these single-use disposal pouches. And I use that kind of as a broad term to talk about Deterra. We also used takeaway envelopes, and we use a little bit of the Dispose RX. And so with that, they gave us about 24 community coalitions to work with. And they said, hey, we want to distribute all these single-use disposal systems throughout the state of Texas. We also want to provide education, and we want you to track almost every single envelope or pouch that you give out. So we knew that this was a huge project. So what we decided to do is we worked with, and we couldn't do it alone, and we didn't distribute directly. What we did is we got in touch with as many independent school districts, pharmacies, both community and corporate pharmacies, hospitals, fire departments, public health offices. I mean, we went to water treatment plants, hospice groups. We have 2 tribal communities that we worked with, funeral homes, Buc-ee's we were trying to get into. And what we did with them is, in order to work with us, we created surveys. And for both of these projects, I will tell you, we used surveys for everything. In order for them to work with us, we had baseline questions that we knew that SAMHSA would be looking for. We also had what we called the wow factor when we reported. We used, oh yeah, so this is, thank you, Megan. So this is something that we came up with. And this was actually a postcard. Because we knew that we needed to quantify our efforts, there were some questions that we need to ask the public. So although we didn't do direct distribution to the public, we had about, I think we have about like 900 right now, distributors all over the state of Texas who have either they have a single-use disposal system, either have Deterra or a takeaway envelope. And so what we decided up front was that in order for us to get the numbers we needed and the metrics that we needed to report to Texas Health and Human Services and up to SAMHSA is we needed to know not only what the weight of the return was, but we also wanted to know, hey, are these federal dollars worth it? So, because you'll hear on the news and with the take back events that they'll report on the weight of the medications that are returned. And while that is one way to quantify, we thought we could do better. And so we came up with this postcard, which is an easy way for the public to report on what they're actually throwing out or destroying in the Deterra envelope. So this is, you'll see, this is the postcard that we wound up using. It was pretty easy to put together, but the hardest part of using this postcard was that we didn't have enough lines to get as many prescriptions as we possibly could. But what this enabled us to do is to report on what people were actually throwing out. And we kind of broke that up into medium, like a high risk, medium risk, and a low risk. And so right now, I think we have over 200,000 of the single-use disposal systems that we have integrated into Texas. We provide education as well for all of our distributors who work with us. And when we also give them, we make it as simple as possible. And that's like really one of the keys that we have found for our distributors. We give them all the tools that they need, education that they need, and the support that they need. So that, I mean, again, I could talk all day, but I'm watching my time. So that pretty much is a high-level overview of the two projects that we have done. And initially it started as a 2-year grant, and it's going on 4 years now.
Amazing. Thank you, Danielle, for sharing.
Megan, can I interrupt really quickly before you introduce the next speaker? Danielle, we have a couple questions that I think may be easier to answer now than at the end, since it's fresh from your presentation. One question is, what was in the takeaway envelope?
So the takeaway envelope, I don't know if anyone is familiar with them, but it's just an empty envelope that people put their prescriptions in and seal them and return them. We put in there a handout and a FAQ would answer questions like, what can you put in the takeaway envelope? What can't you put in the takeaway envelope? It gave them resources. Initially, I put my phone number in there, so I get phone calls all the time at all different hours of the night asking questions. So that went under lessons learned. But from the end user, when we call like the public our end user, where they have any questions. But initially we started small, and I was like, hey, if I could answer any of those questions, I would be happy to do that. So I hope that answers your questions. You can put any kind of a medication, even a liquid, in those envelopes, and they were, you just put them in the mail, and they are returned to an incineration plant in Carthage, Texas, where it's destroyed.
Excellent. Thank you so much. I'm going to see if we have any more questions here. There is one question about the pros and cons of Deterra versus DisposeRx. And I'm going to make the decision that if folks want to chat about it and have some private conversations, reach out to each other individually, that's great. But because this is a CEU provided webinar, we cannot have any type of bias towards any products on here. Even though Deterra is helping co-host this, we really want to get this information out to you about what is best in all of your prescription misuse evaluation efforts. So feel free to connect with other people that are doing similar things in communities across the country. But I don't think we can answer that live. Sorry. I'm going to let Megan go back and introduce Jenna.
Wonderful. So Jenna, if you'd like to start, just give us a 5-minute high-level overview of kind of your initiative that you're starting with the harm reduction vending machines. That would be fantastic.
Good morning, everyone. So our harm reduction vending machine project, I was hoping by today that we would have received our first machine, but we haven't received it yet. Back in 2020, Anthem Blue Cross representative reached out to us and to let us know that they had funding available to purchase the vending machine. They had started with a couple of counties in Northern California, and their project had been very successful. And they were wanting to start to implement a similar harm reduction vending machine project here in the Central Valley. So we reached out to our friends with Fresno County Behavioral Health to see if this was something that they would like to collaborate with. And we went to the board for approval of the acceptance of the funding in December of 2020. Yeah, it was 2020. So we formed a group with behavioral health and local community-based organizations that are doing outreach with homeless individuals and individuals who use substances, and also partner with our local syringe exchange program to find out what are the items that individuals are requesting most. We know that coming from a very conservative community, that syringes were not something that we could have available in our vending machine. However, all of the items that we are carrying are things that people will need most. There will be a Sharps container, home HIV test kit, COVID testing, pregnancy test kits, and harm reduction. Our harm reduction kit will contain Narcan and a Deterra pouch and fentanyl test strip. So we're just waiting for the machine to arrive so that we can get the machine operational. Our first machine will be placed in a behavioral health facility, a wellness center. And we will conduct surveys through behavioral health and with needle exchange to see how people feel about the products that are being offered in the machine, and if there's something different that they're looking for, and so that we can make adjustments. We know that we'll need to make adjustments with the change of the season. For winter, the winter months, it's very cold here. Not snowing, but it's cold here. And so a lot of our folks request warm weather gloves, scarves, socks, things of that nature. So that is something that we were able to find through a vendor, so that we could and we were able to put together a winter survival kit. But now with spring and summer coming and the weather going, here in Fresno, we get highs into 110, 112 degrees in the summer. So we'll need to look at different items for to keep people safe from the heat. We did find a collapsible water bottle so that people it'll be easy for them to find water and refill it so that they can stay hydrated. That's what we have in place right now. We are also talking about the expansion of harm reduction services here at Fresno County Public Health. And there's the possibility of the needle exchange program actually being moved into the health department. And so we're looking at the possibility of bringing another vending machine to this location, so that as individuals come in for syringe exchange and other services, they'll have access to the vending machine, and we'll be able to sign them up. Everything is free through the vending machine. They'll be able to sign up for a code, a PIN number, so that they can just access the machine. Their PIN will work at any of the machines in our area. We will be able to place limits on how often they're able to get items out of the machine. So some items they'll be able to receive daily, some are once a week, and we'll also be able to put age limits. So if someone, that will be connected to their PIN number. So if they're under the age of 18, there will be certain items that they won't be able to access through the machine. So we are very excited about the start of this machine. Thank you.
Fantastic, Jenna. Thank you so much for sharing. And we do have a question. I don't know if Alice, should we ask that now? I mean, while we have it, we have a question. Are the kits free in the vending machine and available to everyone? I think kind of answered that, but I'll let you just clarify.
Sure. Yes. Everything in the machine is free.
Okay.
And we have, a couple other questions come through. I think this is such a unique idea that we're starting to see some traction throughout the country with, and everybody's really excited about learning the many ways you're serving people. So the question is, beyond syringes, did you experience any other resistance or pushback from the board? And how did you approach those conversations about harm reduction strategies?
Actually, we did not face, it was pretty amazing. I've been with Fresno County Public Health for over 20 years, and this isn't the first time that we've gone to the board with a harm reduction item. And previously we did face a lot of backlash, but that was because it was syringe exchange. And so this time I think the item, not that they really asked specifically what items we were going to have in the machine, but I think just knowing that it was going to be more focused on overall health, and that the syringe part was not going to be a part of it. It allowed them to be comfortable with the approval of the project. Moving forward, we'll see what happens. Anthem has funded another project here in Fresno through the Fresno Madera Medical Society, and they received funding to purchase 5 machines. And so their reach will expand from Fresno County to neighboring counties in Madera and Tulare. And when you hear about this type of machine, you automatically want to hear, well, what did they have in it? And everyone's doing different things. I mean, I just talked with someone from San Diego a couple of weeks ago, and their focus is Narcan. And so we will have Narcan in our vending machine. But we know that with our population in Fresno, we knew that we needed a variety of items because people are just in need. So we'll probably be working closely with Madera and Tulare County as they start their journey to develop their machine and what the items. And I think there's a coalition, actual vending machine coalition that's being talked about. So I'll probably be a part of that coalition as well.
Jenna, folks are wanting to know if they can contact you or if there are other people in public health in general that would be good contacts to learn more about this program. So we'll be able to send your contact information out over after this
Absolutely.
is done, but if you want to put it in the chat, feel free to do that. Thank you so
Sure.
much.
Thank you, Jenna. Also, I'll add too, I'm working closely with Milwaukee County, and they're doing a countywide vending machine program, and I'd be happy to make connections there as well. Okay, wonderful. Maria and Marissa, you two are up if you'd like to share 5 minutes about your program and what you're working on.
Thank you. Can everyone hear me okay?
Mm-hmm.
Okay, great. So thank you so much for having us. I'm just going to give the overview, introduce Maria and I, and then if anyone has any questions. So for anyone that doesn't know, we're located in upstate New York, geographically close to the Pennsylvania border. We're also close to Canada, New York City, Boston, and Philadelphia. And because of our location, we're designated a HIDTA community. So that's a high intensity drug trafficking area. We have about 200,000 residents, and we really are unique because we both see urban and rural settings here. So I represent public health and work at the Broome County Health Department, and Maria, who is my counterpart, represents the Broome County Mental Health Department. So together, we both try to use all leverages we can and resources and work together closely on a lot of projects. So this project specifically began in about 2020 when we started discussing drug misuse, prescription misuse in our community, and realized that we really needed more resources here. Our county has several drug take-back boxes, and Maria and I participate twice annually in the National DEA Take-Back Days, but we realized that we just needed more resources. We have a county executive here in Broome County. So the way that our structure is set up, our county executive is elected, and then we have legislators under him, and he's the one that helps create laws and make those decisions. He really wanted to create some sort of legislation around specifically prescription drugs and opioids. And he wanted there to be a tool that we could give to community members to be able to dispose of prescription opioids once prescribed them. So they were getting out of people's homes, either once they were expired, unused, or unwanted. We really wanted to have forward thinking and thought it would be better to have a pilot project in place before we created a law and didn't have any data or just the community response to it. So Maria and I started partnering with local pharmacies to really be able to get that knowledge and behavior change to help support the legislation. So we just decided that it might be more difficult to work with, say, the Walmart, CVS, Rite Aid pharmacies, and thought because they were corporate, it would make more sense for us to start with our hospital systems. So we have 2 main hospital systems here in our community that each have about a dozen retail pharmacies across our county. And we started conversations with them. And then we had another pharmacy, which is more of like a mom and pop, smaller, locally owned pharmacy, sign on. So we learned about the Deterra drug deactivation bags. We had these conversations, for quite a long time, and really waited until we had everything in place before we started the project. So we launched this project in the fall of 2022, and then each of the pharmacies identified anyone who was going to be receiving a short-term opioid. Those individuals would then get a Deterra drug deactivation bag at the point of sale when they're picking up their prescription, along with education about medication safety. We created a survey together to add and get data that goes with this initiative. And right now we're about 6 months into the project, and we've definitely learned a lot and still have a lot of work to do. But I think that so far it's been, really innovative, and we've had great feedback. Some value added that I can just share is that we do allow the pharmacies to have more bags. So if anyone that maybe isn't getting a prescription opioid but wants to learn about a bag and get a bag, we have those bags available to them, along with the education. And then together, Maria and I participate in all sorts of different community education events or forums, the DEA Take Back Day, and then also many community agencies who we partner with who might have a population that needs the bag. We feel everyone can use the bag, when we're able to provide bags to them as well. Along with, Maria has some funding to be able to provide medication lock boxes and then script safety education, because we really believe that knowledge is power, and we really want to change the conversation in our community and have people to start thinking about prescription medications the same way they do with firearms or alcohol, locking them up and then keeping them in a safe place in your home and disposing of them the way that they should. And then really ultimately decreasing stigma, because we really feel like we have a lot of work to do as far as medication misuse is concerned in our community, whether it be, you know, a young person or a senior citizen. And then I just want to share that I know there's been a lot of talk about harm reduction, and I'm just proud to say that here in New York, both at a local level and a state level, we fully support harm reduction and are making really good progress in harm reduction. And we feel these bags are harm reduction as well. So Maria, if there's anything you thought big that I missed, and then we can, you know, take any questions or expand on anything.
I thought that was great. Thank you, Marissa.
Wonderful. Thank you so much, Marissa. We can kind of move into and Maria, we'll move into our, questions regarding your programs, and we'll kind of just address you individually. And if anybody has questions, they can throw them in the chat too. Thank you.
So let's get some Marissa. Maria, I'm going to keep you on the hot spot there, and we're going to ask a question about your surveys. Can you share more information about how you distributed the surveys? If you distributed them at point of sale with the bags, were they attached to the bags? Were you calling later? Just give us all the details about how you conducted those surveys.
So our surveys are actually attached with a sticker to the bags. So they are already there. There's a QR code. So we're hoping that folks will scan that QR code and fill out our very short survey. It's a smart sheet. I don't know if anybody's familiar with the platform Smart Sheets. And it was a short, I think it was about 5 or 6 questions about whether they plan on using the bag. Marissa, do you know the exact questions that are on there?
No, but I know there's questions that we tried to be thoughtful about what we're putting on there, because like, okay, what do we want to know? So some big things were, what were you previously doing with medications that maybe you were prescribed and did they sit in your cabinet? Were you waiting for a take back day? Were you flushing them down the toilet? Were you throwing them in the garbage? We've heard so many crazy things, what people were doing with them. And then questions about, if you were given a bag, would you be more likely to dispose of the medication with the bag? What resources do you think we need? Do we need more boxes in the community? So just questions to really help us support what did people know previously before we were giving them out. And I think too, just anecdotally, how many people have either seen us. We get really good earned media in our community. So when we launched this, we had a huge press conference. So people in our community know about the bags or talking about the bags. We know too, like me as a health department employee, I've had people here who have our insurance, and some insurance companies are sending bags after they know someone's had a procedure. So I have a family member that received one in the mail, and some colleagues here at work. So we just think that just from having the bags available at the pharmacy, besides people that are getting the opioid, we're able to do that. And just having community conversations, we know that there's a lot of interest. So we want to understand, what were people doing previously? Were they holding all of their medications to come to one of our take back days where they bring the garbage bags, or were they, flushing them down the toilet, or just hanging on to them until they might need them later? So that's really the questions that we wanted to understand.
Sounds good. Thank you so much. We have a couple of questions about the return rate for the surveys. So Marissa, can you share what your return rate is? And then we'll go to Danielle. I don't know, maybe too soon.
Yes,
Marissa.
Not good. That is one area we need for improvement. So what we've learned is that, and this is where we're going to be doing more like academic detailing with the pharmacy techs and the pharmacists. We're learning we really need that education to go to like the pharmacy staff that's like at point of sale. The survey response has not been a great return rate, and that's something that we're working on. And I think we just need on our end to have more conversations like directly with the people that are giving the bags, so they can say, hey, there's part of a survey, and if you take this, it would really help us in the future be able to give you more bags like this down the road. So Maria, I don't know if you want to say anything else, but that's an area of improvement for us.
Yeah, and we're constantly getting feedback. I think luckily we're in the community so often with other community agencies, and we talk, Marissa and I talk a lot about this initiative and about, medication safety. So we were able to elicit some feedback from folks who weren't necessarily explained the bag's role and medication safety the way we had hoped. So we've been in touch with our pharmacies, like the high level hospital administrators that we worked with to get this initiative underway. So it's been that's one thing that we learned, is that we have to be in constant communication to make sure that the safety messaging is getting to the customers as we are hoping.
Excellent. Thank you so much. Danielle, can you also share what your return, you've had a few more years under your belt, so I'm curious what your rate of return is, and maybe if you can expand on what is a good rate of return for surveys like this.
Yeah, absolutely. And I know this is an area of pain for people when getting survey responses. And so I talked about, we had a bunch of different levels of surveys that we gave out to our distributors, and then also to our nurses. And it was just identifying the right audience. Like the nurses actually were probably our best sources of filling out information, because at the beginning of the year, they would tell us how many medications they had, and then mid-year they would tell us, as kids left, how many medications that they would dispose of using the Deterra or takeaway envelopes, and then at the end of the year. So I would say they had the highest survey responses that we received from them. The fire departments were also great at giving us a lot of data. And as far as our end users for our postcards, a rate of return for 1% is great, and that's something that we strived for from the beginning. And when I first heard that, I was like, "What? A 1% rate of return?" But just, I think over the past probably like 2 months ago, our rate was like 1.08%, and we were so excited after 4 years. But it takes time, and I think one of the things that you have to keep in mind is that we reported up to SAMHSA, and they understand that, because it takes time for us. We reported on the number of pouches or envelopes that we gave out to all of our distributors. We also were able to report on their distribution efforts. We asked them for every activity that they had, so that provided data at that level. And then we also had, we surveyed the pharmacists that we spoke to, and just providing that motivation. And then also we noticed that touch points. So if our coalitions that worked with us, if their response rate got below 3%, we had an action plan. Okay, so it fell below 3%. So what I would do is I would schedule meetings with all of them and say, hey, how can I support you? What's going on? And it could be something simple like, hey, they had a high turnover. They lost their project coordinator or something like that. So having that action plan in place bumped up our numbers. So to keep in touch and make sure that we were getting those numbers that we wanted to get. Just one other thing I wanted to add too is for the surveys, we had the paper postcards that we had attached to every single-use disposal system that we handed out. But we realized that we also needed to put a QR code in. So we did add a QR code to make it easy. We needed to make it super, yeah, I don't know if you can see that. I have an older one, but they were attached to the Deterra. And then even this is one of the boxes that we used for the single use for the takeaways. And so the fire departments had these hung outside, and the public health, and what they could do is scan the QR code and answer the questions. And we tried to keep the questions super brief and just like yes, no, if we could. And that actually did help with our response rate.
Excellent. Thank you so much. I think that answers one of our questions. Marissa and Marie, you talked about attaching the surveys with a sticker and having a QR code there. So I think probably attaching it with the sticker or some type of sticky glue is the way that happens most of the time. And that makes it very easy to pass out, right? Like there's no problems with the surveys being torn off or anything like that. Have either of you had a problem with that?
No, and I think too, I wanted to mention, so like for our purpose, because when I think QR code, we want to think like, will the entire population be able to use this? Like we think of senior citizens. We really are identifying with this project, someone that's receiving a like first, second, short-term opioid, not someone that's in like a pain management program or an older adult. So we feel like because it's, I mean, I don't want to discriminate, but usually the younger population is more familiar with how to use like the cell phone technology and a QR code. We haven't had any like issues with that so far, but I would say if someone's gonna, do this like project with the full population, you might not get an older adult who might, or someone that's not tech savvy to be able to use the QR code. But through COVID, we really learned that like QR codes, I think they started and then people weren't using them. But I think through COVID, we just learned it like doctor's offices, restaurants, taking like when we do our community health assessment, we do a lot in the community and just QR codes seem to be the way to go right now. Cause like you said, it's easy to get the data. People can start it and then finish it later. You don't have to worry about like, a bag, the paper ripping. So that I just want to mention that out there for everyone too with a QR code.
Thank you.
We did put, Alice, we did put the actual website on there as well as the QR code for those that might not know how to scan or, use the QR code. Tried, like everybody's talking about making it very simple for everybody. We tried to, and we did include some messaging also about, medication safety in our sticker. I'm actually looking at it now. We had in big letters, reduce medication misuse. So just to kind of promote some of that messaging. And we asked them to share their opinion on medication safety. So
Excellent.
that was kind of our hook to try to get them interested in taking our survey.
And we all need data to help support, the ask. I think the other thing, not that we'd ever manipulate like the data, but like what Danielle says, for us at like the county level, they probably won't ask how many people took the survey. What was your risk? Like, I think even if we only get 100 responses, it still tells the story like at that higher level. Maybe for us, like an academic study, it might not be enough of a population, but for this purpose, we feel whatever we can get, we're happy with and can really sell that data home to say, this is why we need this initiative and need this to be supported.
Sounds good. Well, we have one more question. I think this is from Marissa Maria about how you got pharmacists to buy into giving out the bags at the point of sale. What did you do to be able to convince them to add this to their very busy point of sale time when they're getting the prescriptions out the door?
We are so lucky. Both of our hospital systems do work with substance use, addiction, and one of them in particular they already have so many initiatives around this topic. So I just feel like we were lucky in our community that we didn't have to like really sell a whole lot. We reached out to those we knew could make some decisions, and they just agreed that this needs to be done. And I do think our community has, we have a few coalitions that do this work. So I feel like in all of our community meetings and gatherings and discussions and strategic plans, a lot of this work was already sort of happening. So, and I feel like it seemed very easy. Like we were willing to put up the funding, do some of this legwork, and help them in any way possible for implementation. So, yeah, we were really lucky that the buy-in was already there.
And we did make an ask to them. We haven't really revisited that ask, which I think, we're going to need to soon, that then we can get the bags and pay for them up front for the pilot project. But then we would be asking for them to have a plan in place to continue this intervention. Like after we don't have an unlimited amount of funds to be able to purchase the bags. So that was part of our ask, from the get-go with them, and they both were responsive. We did find out, it was interesting, like trying to gather the data, because we were like, how many bags are we going to need? Like we had no clue how many prescriptions are written, and that's all like the pharmacy end of it. So we found out that in our, population of 200,000, that 500,000 opioid prescriptions were written a year, which like blew us away. Not that many necessarily are actually dispensed and picked up. So that was hard too, right? With COVID, we know that there was some procedures that were elective procedures were put off, or someone maybe couldn't have a procedure because of COVID. So we really had to go back and look at numbers kind of before 2020 to get an idea of like working with our hospitals and how are we going to figure out how many prescriptions would be an accurate number. So we kind of faced a lot of different barriers, but just the process of figuring out, you know, their electronic data and how many bags we would need definitely took some time, because each hospital system and pharmacy has a way of doing their own data.
Absolutely.
And Alice, you mentioned about buy-in. You know, we were actually approached by one of our local chains who had heard about this initiative through word of mouth at one of our, you know, meetings. And she actually approached us and said, we want to be involved in this too, which I thought was very, you know, it's telling. I think this is something very easy. Not easy. I mean, it seems easy when you think of the scope of like the opioid epidemic and medication misuse. It's like, it's something that I think people can really wrap their hands around and their brains around, like, oh, that seems so easy. Like, provide a pouch to those to get rid of medications in their home. Boom. How can we sign up? You know, I think that was sort of, and that's kind of the way we, I think, went about talking about this with those folks, like, so easy, and we're going to help you, you know, with everything along the way. So that was sort of
coalitions are good for. I mean, they
Exactly.
do really well, really do. Hey, Danielle, I'm going to ask you to chime in on this question too, because your work was so much in reaching out to pharmacists, maybe not in having them distribute this at point of sale, but just in communicating to them. What have you learned that might help with this?
So we learned that the community coalitions were actually a little bit nervous about approaching pharmacists and talking to them about asking them to do something else, because a lot of the pharmacists and the chains that we visited were super busy and really didn't have time for this as much as they would love to participate. So what we did is we created a video to train the coalitions. And because we work with the School of Pharmacy, a lot of the pharmacists gave us feedback and said, hey, if you come and bring us the single-use disposal systems, we will hand them out. Just make it super easy for us to do. And we also, in creating the video, we got super specific with the coalitions. We're like, hey, if you walk in with a clipboard, like you're going to sell them something, the pharmacists are not going to talk to you. But if you walk in and say, hey, look, I'm from a local coalition, we're here to help support you, and here's the tools to do so, and we're going to make it very easy for you. That really helped with the buy-in. And then we also had the students, the pharmacy students, contact them, and then we would, you know, offer them support and guidance and follow up. And that was a big point for us, is that as soon as we followed up with them and they knew everything was legitimate and that they would not be responsible for, you know, paying for the single-use disposal systems, then they were much more receptive to working with us. And even those who initially did not want to work with us because they said, oh, we need to go higher up and check. And some of them had, you know, they were selling actually DisposerX, but they were very receptive, especially over the past year, to having something, a display. And they really liked having a display. And then that also provided an opportunity for their patients to ask them questions.
That's excellent. I'm just trying to synthesize all of this really great information. I've seen from Marissa and Maria, like, community readiness was definitely such a key, that the pharmacists were ready to jump in and participate. But then Danielle, the information that you shared with just like, don't come in with a clipboard, is not something that most folks will know. And so I think those little things are all stuff that can be helpful as you're setting up your drug disposal program. Thank you so much. I am going to sort of switch gears for the last couple minutes of this webinar and turn to Jenna. And Jenna, this I know is a question that may put you on the spot, but I'm curious. We've talked a little bit about how the harm reduction strategies in the vending machine were received by the governing boards. But I'm curious if you've seen any feedback, had any feedback from the media, and if so, what are you hearing? Has it been helpful? Has it been a challenge?
Locally, we really haven't received a lot of contact through the media, asking us questions or even behavioral health questions regarding harm reduction. Once our program is up and running, we want to kind of work out the kinks, then we will send out a media release. We want to get the word out. We want to explain to the community what we're doing and our collaboration and the community with behavioral health, the Central Valley Opioid Safety Coalition, and other community-based organizations. So we want that information to get out, and we want them to ask us questions. So we're looking forward to it.
It's excellent. Thank you. And I like that you're sort of doing this more of a soft rollout, right? And then going to do that big press release. I love that. Danielle, Maria, Marissa, do you have any experiences that would be helpful to share about working with the media and getting publicity? I know Maria and Marissa mentioned just a lot of good earned media in your area. So interested if you have any tips for folks.
Yeah, I think one thing that like we first and foremost are always trying to educate them on like person-centered language, because we see very stigmatizing, there'll be whatever it may be, talking about opioid settlement funds, DEA take back day, spike in overdoses, and there's the dramatic music, there's the spoon with the needle. And so we first really try to educate them on what we really want to see in our community. And it has been received so well, because a lot of our reporters here in Broome County are like young. We're like their first stop out of college, and then they come here and then they go to a bigger market. So we feel like at any time that we can change stigma and use more person-centered language. And then I really try to engage them on a human level, like make a connection with them. And almost every reporter has their own personal story. And so then whenever we have an event, a story we want to tell, we reach out, we do like a county press release, but then I also will message them. I really find social media too, which feels so unprofessional, but sometimes like we follow all of their Facebook pages and they need to have a story quickly, or they have a short timeline, that we reach out to them. Hey, we're having this event, and we just use every single avenue and opportunity that we can. Like this Friday, we're going to be going on like our live, it's called Around the Tiers, our live news, daytime news story people. It's like a talk show to talk about our DEA Take Back Day that we're doing on Saturday. So every year when that comes up, we reach out to them. So all these events that we do, they know we're like the trusted partner in the community that can talk on it.
And Marissa brings up a really good point. So one is to never underestimate the power of media. They have it. I mean, we've heard so many times, oh, I saw that on the news. Oh yeah, those medication deactivation pouches. Oh yeah, we saw that. And it's the relationship building. We have the most amazing media sector on our coalition. And I feel like she's taught us so much. I mean, it's not only like the news piece, but it's just like other avenues to get your messaging out there. And it's their information and their knowledge is just absolutely invaluable, and truly take any opportunity to put any positive work that you're doing in your community, to put it out there, because people they consume that. A lot of times we think, we had a huge realization with postcards. We always think like, oh, TV and social media, radio, but Honestly, the majority of our folks are still like getting their mail. You know, I think there's this sort of a little bit of a stigma with like, oh, mail, snail mail, it's old and who uses mail anymore? But like literally a postcard is what brought a majority of folks to our Drug Take Back Day event a few times. So it's just really finding what works for your community and keeping those relationships strong and try to get any positive work that you're doing in your local media.
And I would say, like, we offer when a reporter comes, hey, let me show you this bag. Do you want to take a Deterra bag with you and tell your friends about this? And you know, where they can get one, and even a Narcan training. Like, I can't tell you how many reporters have done a Narcan training because they're out in our community and then they get excited and passionate about it. And that's exactly what we want.
That's amazing. We have one final question and then we're going to wrap up for the day. And this is open for anybody. Is there any way there can be a mock QR code on the box that they can ring up at the register and get that data for record or when they come back with the meds? I'm not quite sure if there's any more information. I think that it's trying to see if there's is there any way to work with the cash registers on this QR code and be able to maybe collect data in a different way? Latoria, if you're still here and can provide some guidance, I would appreciate it. I apologize that I've just mucked that up. She said at the pharmacy. So at the pharmacy counter, can there be a mock QR code that could be rung up and then maybe the pharmacist could enter the data real quick? Is that what we're asking? Well, we're gonna take this question and mull it over. Latoria, if you can provide a little bit more information, I apologize. Having a little bit of trouble understanding it, but I think that's what happens when we're just trying to understand all these new technologies and integrate them into our work. So if you can provide any more information in the chat or the Q&A, otherwise we'll bring our heads together and try to come up with an answer for you based on what you've given us. I want to thank everybody here for participating in the webinar. Marissa, Maria, Jenna, Danielle, thank you so much. I know many of you were up early this morning. So I definitely appreciate that. Appreciate the well-rounded information that you've sent us. Megan, Prevention Action Alliance is always thrilled to partner with you at Deterra Systems and bring these resources together. I think you and I will have email participants afterwards. We have a couple goodies to give you. Deterra gives a coupon code out for pouches, and PAA has a public health campaign that's digital that you'll get a free digital membership for a year that can help you in your efforts if you find it useful. So thank you all very much. We appreciate you coming, and I hope you have the rest of a wonderful day. Thank you.
Thank you so much. That hour flew by, huh?
Sure did. I think we could go for a couple more hours.
Yeah. Well, everybody, I'll follow up, and please provide your information if you'd like me to share it with our participants and registered guests. So thank you so much.